I started my Instagram. I think it was the second year of my master's, or maybe it was the first year. It was before the pandemic. I think it was like 2018. So I started it during my PhD mainly just to like get practice with science communication because I also did a lot with science communication during my PhD, and so I just wanted like some practice with that. But I just the internet's a special place, and I just saw a lot of like nutrition misinformation. And I mentioned when I went into my master's, I wanted to know the nutrition secret, and then I learned that there wasn't one. And so it was kind of like, following that, like, kind of revelation for myself, and then seeing the nutrition misinformation that's on the internet. I was like, I want to help people like learn about actual nutrition science and like be able to ask questions and dig deeper in what they see so that they don't fall for the same things that I fell for before I knew any better, kind of thing. Or even in some cases when it's really hard to see through that misinformation, like it seems really legit, like how can you ask questions to dig deeper through that? That's really why I started it.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Welcome to episode 130. Thank you so much for joining me today. If this is your first time tuning in, be sure to hit that subscribe button so you stay up to date with the latest content. And if you get value from this episode or show, please support the show by leaving a 5-star review. It really helps with the algorithm. And share this with a friend if you think they would get some value from it. This was a fun conversation with someone I've been admiring for a while in the public health Instagram space. I love the theme throughout her journey of just going with her gut and believing in herself. She also shares her untraditional way to become a dietitian, which I thought was very fascinating and I didn't know much about. And she also loves metabolism, and you'll hear more about what that means throughout the episode. Also, the sound effect I thought didn't work first time using this, but regardless, you'll hear it on future episodes. Enjoy. Today, we have someone who strives to bridge the gap in translational spectrum to improve nutritional education and care. You may know her from Instagram at steph.compton.phd, where she shares science education for health professionals and talks about nuanced nutrition information. She's an expert in cancer metabolism as well as a registered dietitian. She got her bachelor's in biology at Emory and Henry College, then her master's in science in human nutrition, food and exercise and dietetics at Virginia Tech. She recently completed her PhD in human nutrition, foods and exercise at Virginia Tech. We have Dr. Stephanie Edwards Compton, PhD, RD. Welcome to the show.
Yes, thank you for having me. I'm excited to chat.
Yeah, I'm so excited. This is a new platform for everyone else listening. You probably guys heard the cheering. This is going to be something that's new that I'm going to be using a lot of, but I'm very excited to have you on and I guess be the guinea pig in this new platform, but still going to be great content. And I'm really looking forward to hearing a lot about your story. So tell us, how are you doing and how you've been coping during these 2 years?
Oh my gosh, that's a big question. Honestly, I'm doing great, kind of settling into, post PhD, kind of not really post pandemic, like that kind of weird gray area that we're in right now. It's been a lot to like do a PhD, finish a PhD, and like go on to get like a job afterward in the pandemic. But honestly, like it's going well. Like we're kind of going on the upswing from here and going through it. So doing pretty well.
Well, I'm glad to hear that, and I'm glad that you're able to get through it. And I could only imagine the kind of challenges that had come up because of the pandemic.
Oh, yeah.
Yeah, and I guess we could get more into that a little bit later on in your story. So how do you identify, and then tell us a little bit about your personal background?
Yeah, sure. So my name's Stephanie Compton, like you introduced. My pronouns are she, her. A little bit more about my background. I joke all the time that I kind of like ended up where I am just by like chance, but that's kind of kind of just like the going with my gut kind of thing. That's like the underlying theme of my career and what I've done so far. But my background is, and we're going to talk about it in this episode, I'm sure. But more about like, I started out in biology, moved into more like community nutrition and dietetics, and then ended up in basic science studying cancer metabolism, and now I'm doing more clinical research as a cancer nutrition expert. So that's a little bit of that background there, but I'm also a registered dietitian, so I kind of try to bring and bridge that gap between bench to bedside and beyond, is kind of how I've been describing it. How we can bring practice to real life and into practice and into research, and kind of bring all of it together to be able to like move the field forward by taking into account a lot of different things rather than just trying to shoot it through one single pipeline. So yeah, that's a little bit of my background, which again I'm pretty sure we're going to talk about in the episode today.
Yeah, yeah, absolutely. Well, thank you for sharing that. And before you said that you were in Baton Rouge, Baton Rouge,
Hmm.
Louisiana,
Yeah,
I feel like I should commonly just ask my guests where they're located. So from now on, I'm going to ask the guests where they're located.
yeah.
Okay. And just to get like a better idea of that bridge to bedside to beyond, I'm kind of lost in the bedside part of it. Can you explain that part?
Yeah, yeah. So that's kind of where my background as a registered dietitian kind of comes in. So my work as a PhD student was really bench side science. So what we would learn is like basic science, working with cell lines, working with mice, like that kind of thing, doing like that kind of research. And then at the bedside, that is more of like my when I work as a registered dietitian. So that's when, you know, you're going into rooms in like hospitals, or you're going into like a counseling session with a client or a patient, and you're talking about like nutrition switches that they can make to like support their health or to support their condition, or you know, make any kind of changes that they're interested in. So that's kind of where that bedside comes in. And then I say beyond because putting that into practice and getting it to a place where we are moving that research along the spectrum to getting it into actual like common practice and more of that like public dissemination. That's kind of the beyond. So I try to work kind of along that spectrum, either with my research or with like my outreach on social media, that kind of thing, just to get that bench to bedside and beyond through to other people, especially with regards to nutrition research.
Okay, well, I appreciate you sharing that. I think that clarifies it a little bit more and gives us a little more
Yeah.
context. Maybe when we chat a little bit more about that a little bit later on. And yeah, it's interesting that you said like using outreach in your social media campaign, and we'll definitely get into your social media because that's what I know you from. And then only after the fact have I known that you're like an expert in the cancer metabolism and those kinds of things. But we'll learn more about that today. So before we get into more of your collegiate story, what does public health mean to you?
Oh man, I love that question, and I feel like I probably have a different perspective than a lot of your other guests because I didn't necessarily do like a degree in public health, right? And so whenever I kind of think of what public health is to me, it is I still view it through that lens of like translational research in practice and real life, right? It's the integration of like what we know and what we're doing in terms of research, but also like what do we know about people that are actually just like out living their lives and how it's that kind of information is disseminated out to the public. And I love that integration. I'm very much like a connector. I'm very multi-passionate. You'll probably like find out through this interview. But you know, I love that connection. And I really feel like public health encapsulates a lot of that of how do you get information out? How do you really study communities and populations and bring that into inform then how we can move things from again like that translational science spectrum.
Yeah, love that. And public health is so encapsulated in so many ways that it can be used to do so many different parts of that process that you were speaking about. Okay, now getting into your bachelor's story. You got your bachelor's degree in biology at Emory and Henry College. What was
Mm-hmm.
your thought process going in for your bachelor's degree?
Oh, that's a great question. So a little bit more background about that. I was a first generation college student, so I didn't really know a ton about higher education in general, college in general. I kind of went in with this idea that I just wanted to do a general health profession, right? Like I kind of went in saying like, hey, I want to work in like healthcare in some way. I originally kind of set on possibly doing something like occupational therapy. And so, Emory Henry College, I love Emory Henry. It's a fantastic little private, like liberal arts school in southwestern Virginia, and it was close by my house, which made it convenient that I also got plenty of scholarships to be able to go. But I ended up loving it. Like it's a fantastic institution, and I really got a lot of hands-on experience with biology and research, like even just as a student, like an undergrad student, which is not very common in like larger universities. I feel like I was able to do my own research project as an undergrad, like fund it, like I got a grant that funded it, like all this kind of stuff. But I kind of went into my undergrad thinking, okay, well, if I'm going to do a health profession, what would be like the best major for me to do that with? I really liked science, so I kind of went in. I'll be a biology major. I will minor in psychology, like kind of getting in those both like the behavior and also like the biology portion of it to be able to inform that. And throughout my undergrad, I really feel like I fell in love with metabolism is what I really like decided that I loved. I had a great like professor that taught metabolism and all this stuff, and it was fascinating to me. And I also at this time was kind of going through and shadowing a lot of people. So I shadowed some like occupational therapists and physical therapists and kind of like along those lines. And I have immense respect for those professions, but I did discover that they were not for me. Like I just like I'm not really like vibing with this as much as I thought I would. Like I don't think I want to do this for the rest of my life. I don't think I want to pursue like any like further education towards this. And so kind of towards the end of my bachelor's degree, I was kind of just trying to figure out what I wanted to do. I actually did a research project studying plant population genetics in American ginseng, which is completely random. When you like think of what I'm doing now, you're like, why did you do that? And it was literally just because I thought it would be cool, like project to do, and I knew I wasn't going to go into that kind of realm of like further career. And so I was like, well, I'm here and I can do it. So, and it's interesting. So like, I'll just do it now. And that's kind of my like thought process behind that. But throughout that, again, like because I fell in love with metabolism, I was like, you know what, I really am kind of interested in maybe nutrition realm. And that's when I was kind of like, okay, I really like metabolism. I'm kind of interested in nutrition for myself, like because I was kind of in that mindset of like, you know, there's a secret, there's a nutrition secret out there. I just don't know what it is. Like, you know, reading all the magazines and the blogs and like that time on social media with nutrition content was also just a really interesting time in general. And so, because that's like, you know, the real boom of like Instagram and like all of these things. So I was in this headspace of I really like metabolism, but I also really like nutrition. So how can I combine those two things? And I kind of settled upon dietetics and possibly working in an area where I was studying what are called inborn errors of metabolism, where essentially it's like a you're born with something in a metabolic pathway that is like not working in a way that will support you just like eating a quote unquote, I'm doing air quotes, normal diet. So you have to change your diet in some way to accompany that change in your metabolism. The example I always like to give that people are usually most familiar with, if you've ever looked at like a bottle or a can of diet soda, there's a warning on it that it says it contains phenylalanine for phenylketonuria. That's an inborn error of metabolism. So like that is a like something I was like, oh, that'd be a really cool combination. Like I can do nutrition, I can figure out the secret, I can like do all this stuff. And so that's kind of how I ended up doing what I did for my master's. But throughout my undergrad experience, it was just a lot of me trying things out and shadowing and discovering what did and didn't work and like honestly just like messing around with a lot of different stuff to see what I liked, and also taking time to do things that I did enjoy, like that weren't necessarily like just towards my career. Like I also I played trumpet in my undergrad. Like I did like a whole bunch of other things just to be able to have the experience in undergrad, and Emory Hingham is a great place to be able to do that too. But I was really grateful, especially looking back on it, for the ability to be able to do so many things and try out so many things because I think that really helped like, push me along throughout my career.
Yeah, well, thank you for sharing all of that. And I think it is really important first that you highlight, like, you chose the school because it was close to you. You got a lot of
Hmm.
scholarships, as well as you're getting the added benefit of getting like more direct interaction and doing research and doing things that you don't think you would have been able to get or easily get at a large institution. And it sounds like you're able to take advantage of a lot of experiences. And I think it's also very important when people hear that, especially in undergrad, I feel like you should do as much as you can to figure out, okay, these are things that I actually like, or like to your point, like I didn't like these things, or I knew that I didn't see a future in these things. So let me do the cool things that I like about this right now, while I try to figure out what is the next thing that I want to do. And I want to ask, like, how does one fall in love with metabolism?
That's a good question because I feel like a lot of people usually are like, "Oh no, like let me not remember the Krebs cycle." So I mean, I don't know if it was just my like nerd tendency or if I just had such a great professor that like really facilitated like our actual learning. I mean, of course, we were still like, okay, let's draw out the Krebs cycle, like do all the things, right? But I just found it so fascinating that like while I don't know, I've always been like really fascinated by this. It's just like while I'm like doing my thing, like being a person, right? Like all of my cells are also simultaneously doing these processes and like how we discover that incredible and how they do that incredible, like fantastic. And then kind of from the nutrition perspective, so I learned all the metabolic pathways, right? Like glycolysis and the Krebs cycle and the electron transport chain, all of those good things. But I never learned about the beginning portion of it. Like, okay, once our cells start doing that, then like how did they get the stuff to begin with? And so that's where the nutrition portion also kind of was like, oh, maybe that'd be a good place to like let us look at like the before thing because I feel like that is also really important to like what are the cells doing kind of thing, and then how does that influence everything else, right? Like looking at that from like a really small perspective to a really big perspective. But how I actually fell in love with metabolism, I don't know how to answer that.
Yeah, that's awesome. But I like the idea of like, okay, I found this thing is very interesting, and I see that there's a gap in between like the beginning part, and that is where nutrition falls in. But we aren't learning about that. How can I learn more about that? Which is a
Mhm.
cool way to think about it as well. And during your time in undergrad, you had two positions at Emory and Henry College. So one as a chemistry lab technician and one as a supplemental instructor for genetics and general biology. Do you want to just talk a little bit about those experiences?
Yeah, for sure. So part of me going to Emory Henry was also the ability to get a work study position. So in addition to being able to get scholarships, I got a lot of like financial aid and again the ability to do work study. So my chemistry lab technician position was a my work study position, which was it was fantastic anyway. Like still talk to my boss from that like on the regular because like I learned so much from that. So that job was essentially we were the ones that were putting together all the stuff for the general chemistry labs. So like we were making the reagents, we were making the acids and the bases and like all of that kind of stuff and like cleaning the glassware and putting it out, like that kind of thing. We also kind of served as the handy like people that would go out into the building and like fix things that were broken. So it was a really interesting experience. And I also, had the opportunity to like sit and do homework when we had like a downtime or we didn't have a lab that week or something. But I was really thankful to be able to do that kind of position because it gave me like living money to be able to like live on while I was doing my undergrad. And then the supplemental instructor position was in addition to my work study, which I again once again did in order to make enough money to survive. And so, but I really liked that position also, especially as I got into like further into undergrad and I had like taken some of the classes and went asked to be a supplemental instructor because I think that gave me like, my first opportunity to really get into like the other side of education, like so not just the learner but like the teacher side, and really talk to people who were having questions about a class or like how could I explain something that would help them or how could I like lead a study sessions that people would do well on their exams, like that kind of thing. And so I actually served as a supplemental instructor for a genetics class. That would make sense. And then the other class that I served as a supplemental instructor for, because I went to a liberal arts school, right? So we had to take a variety of classes. It was a class called Great Works in Context, and it was about The Great Gatsby, like just the book. So I was teaching people about like The Great Gatsby, like that was my other one, which didn't necessarily make sense, but I loved the professor, so that worked out. But I really took those positions to, I mean, one, get the experience of doing them, but two, like it just really supported me being able to do my undergrad. I also worked like two other outside jobs. Like I worked at a fast food restaurant for a couple of years. I worked as a soccer ref on the weekends, like whatever I could do to help do that while I was also like not necessarily taking away from what work I was doing or what homework I was needing to do, that kind of thing. And so those positions were really helpful to be able to do that.
Okay. Yeah, and that definitely does sound like it was
Mhm.
helpful. I could imagine how difficult the Great Gatsby would have been to teach people.
Yeah.
But all great experiences regardless, right?
Yeah.
And you were also an international summer school prevention medicine, exercise, and the environment,
Mhm.
I guess, program at the University of
Exeter. Yeah.
Exeter. So tell us more about that. And I'm guessing that's in the UK.
Yes, it is. So that was actually, I applied for a scholarship through my university. I think it's just at Emory Henry, but it was a scholarship that essentially paid your way to go attend a short summer program in the UK, any university that you wanted, any program that you wanted. And I won the scholarship, which I was very thankful because I would have never been able to go to the UK in anyway without that scholarship. And it all just kind of worked together because I got my grant funded to do my like research as a undergrad. It was a very like small grant, like it's not anything like massive. If you're listening to this, like it was like Appalachian College Association kind of stuff. But they it also came with a small stipend, and so like I got both of those at once, and so I was like, okay, like I can afford to go to the UK for this program, and I can afford to like eat while I'm there. So like great, let's go. And so I decided to go to the one at the University of Exeter because they had that focus program of that preventative medicine, like talking about exercise and how exercise is health promoting, but also like the environment is really important for that process as well, like the built environment, the environment in which you're able to do exercise. So it was a really great combination of like science and practice and like implementation. And so I learned a lot in that, and also got to experience Exeter, which is a cute, little town. I'm kind of in like the southwestern portion of England, that I would have never got to experience otherwise. And so like getting that scholarship was a definitely like fantastic little end to my time at Emory Henry because I got it in between my junior and senior year. But that was also just a great program to do.
Yeah, that sounds like a cool experience, and I could imagine just being able to travel abroad and get that experience
Yeah.
of being in somewhere like the UK and just interacting with people while you're learning about this cool like short program as a student is always something that I think is very helpful, and especially like retroactively looking back on it.
Mm-hmm.
Yeah. So, are there any other undergrad takeaways before we move on to your master's program that you wanted to share with us?
I think I kind of covered most of it. As I mentioned earlier, the underlying theme of a lot of my stuff is following my gut. Which does come with, the privilege of being able to get to the point that I did and like be able to follow my gut and be able to like shadow people and all of that kind of stuff. But if you are an undergrad or if you are not sure what you want to do, or at least looking back on my undergrad years, you don't need to know. Like I said, like you can figure it out along the way, I promise. But I always tell people to shadow and to ask questions and to, if you can spend a day in the life or an hour in the life of someone who maybe has a job that you want or that you're interested in, do that and ask them questions because I think that was one of the more invaluable things that I did that really like pushed me towards what I was doing now.
I love that, and I definitely agree with that. Like, there's just so much out there to know, especially like if you're interested in like public health, health related work.
Hmm.
There's so many different ways that you can utilize that. So yeah, just getting experience in like what you like, and what you don't like, and just getting exposure to new things is so important. So I plus one to that. And talking more about your journey into like your master's program. So you said you when you were coming into your undergrad, you were kind of thinking like OT, and then you switched across to biology, and then you fell in love with metabolism. You thought about nutrition, and you mentioned a word a little bit earlier, dietetics.
Hmm.
What is dietetics before we get into like more of your story? Because I think that's important as well.
Oh yeah, for sure. And I've actually like talked about this before on my social media because I feel like nutrition and dietetics are kind of the same thing, but also not. It's a very interesting relationship. So dietetics is essentially like the study of like and the study and the practice of implementing nutrition in a population. So that is essentially like the practice side of nutrition. So in nutrition as an umbrella, you can have like nutrition science, which is like very research focused. You can have nutrition more in a public health perspective, where you're implementing like nutrition policy kind of thing. But you can also have that practice side of it, and that's dietetics. So what makes it a little bit different with dietetics is that you are learning like very specific, like behavioral modification. You are learning medical nutrition therapy, which is like how you can implement nutrition in a critical care or acute care or outpatient setting, and for different like disease processes. So it's very much like focused on how you manage different disease processes or different situations through medical therapy. So like that includes things like tube feeding, like that's enteral nutrition or parenteral nutrition, which is when you feed through the vein, or it's like very specific diets that you would have to implement for someone who has a certain condition, like those kind of things. And so that's kind of the difference between dietetics, which is very practice, and nutrition, which is very broad.
Okay, well, I appreciate that and probably get some more questions on that a little bit later on. So you decided to pursue your Master of Science in Human Nutrition, Foods, and Exercise at Virginia Tech. What was that thought process like coming out of undergrad, knowing that metabolism and nutrition and dietetics were things that you were interested in? How do
Yeah,
you think
yeah.
about that?
Yeah. So whenever I was kind of looking into my next steps from Emory and Henry, I was a biology major. I had never taken a nutrition class, so like I didn't have an actual nutrition background from that. And so in that the search process for where to go, part of my search process was where can I go where I can take the dietetics classes, which is largely an undergraduate degree, while I'm a master's student and be able to kind of catch up because to become a dietitian, you have to do the dietetics courses. You have to get like finish all of those to get what's called a dietetics verification statement, which is essentially like a certificate that says you actually took the dietetics classes. And you can't get into a dietetic internship, which is where you get like practice hours without having the verification that you actually did the classes. Like they need to know that you did the medical nutrition therapy, that kind of thing. So, part of my looking into where to go next was where's a place that I can do that? Where's a place that I could go that would have financial support for me as a graduate student? And at the time, I then long-term boyfriend, now husband, was also at Virginia Tech. So that kind of like fed into the decision to go to Virginia Tech, because they had all three of those things. I could do all of my dietetics classes as a master's student. I had identified someone who would take me as a student, like kind of in their lab. I also had the opportunity to do a graduate teaching assistant job, which paid for my tuition and also gave me a small stipend. You know, it was a livable stipend. And it was where my husband was. So it kind of worked out really well that I was able to like get in there and do everything. And when I was trying to figure out like what my focus should be, because so human nutrition, foods, and exercise as like a major, something I might call it HNFE. That's what that stands for, human nutrition, foods, and exercise. But they had three different tracks that you could like study under. So they had community nutrition, and they had more like clinical nutrition, and then they had a basic science like molecular and cellular nutrition. And so, trying to figure out what I wanted to do like during my master's and who I wanted to work with, I had originally thought like, okay, to become a dietitian, I need to know about clinical practice, I need to know about food service and meal management, and I need to know about community nutrition. Those are like the three areas that when you do a dietetic internship, you have to get experience in those three areas. And so I was like, well, I could probably do the clinical fine. I've worked in food service like during my undergrad. I don't know anything about community nutrition, so that's what I'm going to do. So that's how I chose my like master's degree. I mean, I was also interested in like how nutrition gets into the community. And so I ended up kind of doing my master's studying. Essentially what I was doing is I was trying to see how nutrition programs that are implemented in schools, how they could be assessed if we looked at student outcomes. So if we could we look at attendance, could we look at like grades, could we look at like people who, you know, had less like I guess what's the word I'm looking for? essentially like their grades, their outcomes, their attendance, like those kind of things. Could we look at that before and after we implemented a nutrition program in a school and see changes in those things because of the nutrition program? So that's kind of what I did for my master's thesis while I was taking all of the classes for dietetics. So like intro to nutrition, I was like sitting in there as a graduate student. It's like 1,000 level class, just like chilling, um, just like learning all of the things all at once. And I was also doing that for my master's thesis, essentially. And in this, I'm just going to keep rambling about my master's now. In this process, I also discovered how incredibly expensive it is to become a dietitian, and I discovered that I would not be able to do it like the traditional way. Because the traditional way is you get your verification statement, you get into like you apply for like dietetic internships. They accept you kind of on a match basis. It's kind of similar to other health professions that do matches. And then you do a year long unpaid internship that you have to pay for, that where you're working full time. So I was like, okay, well, I can't do that. Like I can't afford to live for free, right? Like I can't afford it. My then boyfriend could not afford to help me with that. My parents couldn't help me afford me like living expenses or anything like that. So I was kind of like, well, I don't know what I'm gonna do now. So it was like a very humbling experience to like, go into this like this really big mission and be like, I'm gonna do exactly this, and be like, oh, just kidding, I can't afford it. And so that was kind of like mid masters freak out that that I had, where I was like, okay, well now my plans have like completely changed, and now I don't know what to do. And that is kind of where I ended up meeting my PhD advisor and talking to her about this kind of process.
And how did you meet her, and how did she talk you through all of that? Yeah, and then I have another question.
Yes. So I actually met her. So one of the classes I had to take as a graduate student is a translational science course where, like I said, we had three tracks kind of across the translational spectrum, right? We had basic science and like the molecular and cellular. We had clinical, and then we had community, and I was in the community track with a biology background. But we all had to take that translational science class. And so within that, they had professors from all of the different tracks come and talk to us about like what they did, things that are relevant for us across the spectrums kind of thing. And that's where I met my advisor, my PhD advisor originally. And so in me trying to figure out what to do next, because spoiler, there's not much that you could do with just a master's in nutrition, unless you want to like either get some more experience doing something, you want to go on and get a PhD, you want to do dietetics, you want to do like I'm sure there are many places that you could do like go with a master's in just nutrition, but I was kind of like I don't know what to do. So I thought about changing my major and going back to more of basic science because I once again I tried out community nutrition. I loved it. I love the area of it, and I still use a lot of those skills that I picked up from there to do what I do now. But I also was like, I don't think I want to like I want to do research on like a lab again. Like I really liked doing that as an undergrad, and so I was like, I want to do more of that again. And so I ended up meeting with her and just talking to her about like she was involved with a couple of different majors because she was one of the few people that studied cancer at Virginia Tech, and so she was involved with a couple of different majors. But I kind of met with her, and I was like, "This is what I kind of want to do. This is what I'm interested in." Like, once again, I really love metabolism, and like that's what I want to do. And so, because again, I wanted to do like inborn errors in metabolism as an RD, and then I was like, "Well, I can't be an RD, so whatever. I don't know what to do." So I met with her, and then the conversation ended with me asking her if I could join her lab. Like first conversation that we had like one-on-one, like I met with her and I was like, you got an opening in your lab? And she's like, yes, I do, but like you have to be a teaching assistant because I can't afford to pay you, but like yes, I have an opening. So yeah, I kind of forced myself upon her lab, but it worked out really well. So
Yeah. And to that point, I think is like knowing what you want to do, because a lot of people might be in those circumstances and they can't even say, this is what I'm thinking. And I think in you knowing what you wanted to do, you were able to have someone who has more experience, more perspective on the field, be able to like direct you and give you that opportunity. And kudos for you as well for like pitching and like asking to be part of the lab, because many people would not do that as well.
Yeah.
Um, and I wanted to ask a little bit more about your nutrition. Actually, let's dig into the lab. Well, did you do that work while you were in your master's, or was that in your PhD? Because then we could just wait until.
That was a PhD.
Okay.
Yeah.
So you shared earlier for your master's thesis, you did work around nutrition in school and relating that to outcomes when you changed like a nutritional plan that a school took. Did you see any changes in health outcomes or the other outcomes that schools measures?
That's a great question. I wish I could answer it because because I did all the work trying to essentially what I was doing is I was trying to gather like these state level indicators from this like the state of Virginia. So that involved me going through the Department of Education trying to like get access to these because obviously like it's very well protected. Like they don't just get this data out like anytime anywhere. Like this is a very long process. And the one of the programs that I was involved with at the time was called Virginia 365, where it focused on southwestern Virginia and Richmond City, providing meals for students 365 days a year, essentially, is like what it was. And so I did a little bit of work where I was surveying principals on like, gee, how feasible do you think this is? And I did get like that kind of data, but I didn't ever get access to the educational data from the state of Virginia. In fact, I did not get access until I had already quit my master's. And by then, they had kind of stopped the program. And so, like, unfortunately, the actual research component of my master's, I didn't get a lot of like fruition from. But it was a very interesting experience still to really think about the ways in which we could possibly analyze or possibly see changes because of the implementation of these things and how those things relate to like the outcomes of like if you give kids access to like food, right? Like nutritious food that they need 365 days a year, would it help their grades? Like, would it help their attendance? Would they be more focused in school? Like that kind of thing. And so it was at least interesting to be able to see how we could kind of implement that, but also how we could possibly see the outcome from it that wasn't directly related to like these kids went to a nutrition program and afterwards they took a post test and they knew more about nutrition, right? Like it was interesting to see that.
Yeah, that's awesome. And I know I work with a couple of partners that work in schools, and I've worked with school data in Alaska when I worked in Alaska, and I guess I know how difficult it can be to
Yeah.
get that get that data. But the partners that I do work in North Carolina, they do work around like trauma and resilience and like
Mm-hmm.
trauma informed school policies, and then they measure a lot of those like OSS. So out of school suspensions, in school
Yeah.
suspensions, looking at those kind of indicators. So yeah, it would be cool. It would have been cool if you like got the results from that. But hopefully someone out there can do that for all of us.
Yes. Yes, for sure.
Yeah. And so you said you quit your masters, but before you quit your masters, you were a Braille transcriber at Accessible Technologies at Virginia
Yes.
Tech. Tell me about that experience.
Yeah. So again, the theme is also very multi-passionate, doing and trying all the things. So when I eventually moved to Virginia Tech, and like right before I started, essentially I was like, okay, I need a job. Like I need to be doing something. I need income coming in. And my again husband and boyfriend at the time worked at the Accessible Technologies office at Virginia Tech. He's a computer science like IT kind of person, so he was more on like that kind of side of it. But his boss was like, hey, we just got a request to make a quantum mechanics textbook in Braille. And I need somebody that can help me transcribe this because obviously, like, a quantum mechanics textbook is probably massive, right? And so she was like, I need a student worker to help me do this. Like, if y'all know anybody, let me know. And my boyfriend was like, I know somebody. so so I ended up interviewing for the position and like was brought on in the summer before I started my master's to literally like learn Braille and be able to learn how to transcribe print text into Braille and like proofread it to be able to then print a Braille textbook, which was like such an incredible experience to like I don't know many people that have had the experience of having like being able to learn Braille from like that perspective of like the creation of something like this. And I don't know anything about quantum mechanics, so like, it was just an all around like such a cool learning experience. And I ended up working there for several years during both my master's and my PhD, just getting the experience of like, so I helped transcribe a quantum mechanics textbook, which if you've never seen Braille, like a Braille textbook before, like, the normal textbook is like this big. And I think it's like the national average is like one page of print is 5 to 7 pages of Braille. And so like the actual textbook when it was done was like to my
Massive.
shoulder, like from the floor. So it's like very large.
Wow.
That a really cool experience to be able to do that. And Virginia Tech had the capabilities that like they would take requests from like other like local colleges to be able to create things like that because they had the capability at the time. I don't know if they're still doing that or not, but so that summer I did the quantum mechanics thing throughout that year, and then the next year I came back and I helped make tactile graphics. For a neuroanatomy textbook. So I got to bring in my biology a little bit for that and essentially learned how to use like Adobe Illustrator and make graphics that then could be felt, to make them like more accessible to people who were like attending a neuroanatomy class, and you have the slides, but then you can actually like feel where they're describing on the slides, through the tactile graphics. So I did a little bit of work in that. I also helped make the alternative text for a business textbook. So alternative text is text that is embedded in like online pictures or graphics or like graphs, things like that, that is read aloud by a screen reader. So the screen reader, they'll literally like if you have a screen, like I always give the example of like if you have an iPhone, VoiceOver is a screen reader. So like if you turn on VoiceOver, it will read everything that's on your iPhone screen. And so I was kind of involved with making the just text descriptions of graphics in a business textbook, where if you were listening to that with a screen reader, it would read aloud like what the graphic was or what the picture was, which was a really cool, like, again, opportunity to kind of be on the side of like creating accessible materials and then like have that actually be implemented and teach other people how to do things like that too, like color contrast and alternative text and stuff like that too. So I really liked the experience. I still use like to this day some of the stuff that I learned in that job, in like my regular like everyday life.
That is fascinating. Very, very fascinating. And
Yeah.
yeah, it's not an experience I don't think many people even think about having in life. But and I'm glad that you were able to do that, and also like on the side of like just creating accessible information and documents for people is just very important. And it's something that we overlook a lot, because I'm guessing that there are many, many documents that don't have Braille transcripts that people can use, and that just
Mm-hmm.
lack of information is something that we have to think about as well. Okay, so you got your PhD in human nutrition, foods, and exercise at Virginia Tech. You said that you quit your master's program. So first of all, did you actually quit your master's program, and what was that like process of meeting with the professor whose lab you joined, and was it like imposter syndrome around like quitting this program and like starting the PhD, and how did that process all work out?
So to clarify, I didn't actually quit my master's. I did technically finish it.
Okay.
So yeah, so even though I didn't have like the main thesis project actually like being able to do like anything with it, I still did the thesis and like defended it and all that kind of stuff. But I still did have to have the conversation of like, this was great, but I wanted to move into this lab again, which was that what did have a lot of imposter syndrome with it, because I, kind of come into it saying like, oh, I'm going to try out this community nutrition thing. I want to become a dietitian, and then neither of those things really happened, and so I had a ton of imposter syndrome, being like, hey, I'm going over here to like do some more basic science with like somebody else in the department, and like appreciate everything that you've done. I think we, generally left on relatively good terms, but approaching that conversation was really nerve wracking for me because I felt like I had not necessarily let my advisor down, but like I feel like I didn't do anything, or I didn't do enough to be like, okay, like I feel confident like handing off the baton to the next student. And so I didn't really have anything to hand off to anybody. But I kind of just approached that conversation of just being very honest and like, hey, like I really appreciate you taking me in and like, advising me for the past 2 years throughout my master's, and like I appreciate all of your work and like everything that you've done. I do want to move more into more basic science again, because based on my like bachelor's experience. And so I kind of like pitched it according to that. Um, but yes, it was very nerve wracking.
Yeah, and I also think like it's awesome in the sense that you went from your bachelor's program doing like more in the ground like cellular type stuff, and then your master's program, it sounds like it was removed from that in more like higher level dealing with schools and nutrition programs. And then as you said, like, oh, I kind of like that more and digging more into that. So what was your thought process of like getting the PhD just in general?
Yeah. I mean, honestly, I had thought about doing it after dietetics anyway. I liked the idea of it, but I didn't really know at the time if that idea was because I just like wanted to have the terminal degree or like there was an actual reason to do it. But after I couldn't become a dietitian, I was kind of like, well, I mean, I like teaching. I've had like these various teaching experiences. Like I like research, so like maybe a PhD is just the next thing that I could do. And so that's kind of how I feel like I should have had like a bigger like, oh, I'm very passionate about becoming a PhD and doing all of this PhD research. But at the time, I was kind of like, I don't know what I'm doing, so like I'll just go do this. And I really liked my advisor. And again, she was studying metabolism, so I was like, that's what I wanted to do this whole time. And so kind of went into it with that, but it ended up, and again, I hadn't actually done cell culture work when I started my PhD, which was entirely cell culture. I had done microbiology in undergrad, and then obviously my research project in undergrad was like plant population genetics, so like not exactly the same. And I'd also never taken the cancer class. So then I went into a PhD studying cancer metabolism in cell lines, which I'd obviously never done before. But yeah, that was kind of like I guess the thought process behind that. But I ended up really loving my research and like really loving what I did during my PhD, and like I have absolutely no regrets.
And how did you go about getting like ready and like having everything to know about cancer, to know about cellular line biology that you're doing? What was that process and learning curve around that?
A lot of trial and error, honestly. I still remember like the first day I went into lab, there was so my lab mate at the time, he had been there for like maybe like 6 months more than me, but he had experience doing like cell research and like things like that. And so I remember like the first day I went in to like just watch him do something, he was having me do like some protein assay or something like that. I messed it up like 4 times. And I was like, I'm so sorry. Like, please do not hate me. The first day I'm coming in here, I'm messing up all your stuff. But yeah, it was a lot of trial and error. I mean, my advisor was really great in that she taught me some of that initial cell culture stuff. It wasn't that much different than like microbiology stuff, right? Like you have the cells in the dish and you give them food and then they grow. Like so it wasn't like as different as what I had done, but it was definitely a learning process of like how often do I need to feed them? How do I keep them alive? What happens if I contaminate them? Because I contaminated them all the time when I was first starting. And it was just like this trial and error thing. And then in learning about cancer, I did take a class in the first year of my PhD, but it was the second semester of like the fundamentals of cancer that my advisor taught. So like that was, phenomenally helpful for getting to know more about cancer. But before that, it was a lot of just me reading papers. Like, my advisor would just send me things, be like, hey, can you like read this? Because it's going to give you like a background of this. And so a lot of that was DIY at the beginning. And then taking the class was like really what kind of propelled me into understanding like cancer as a whole.
Yeah, that's really great to hear. And I think a lot of us, like, we don't always have to have or know everything, especially even when going into a PhD program, as you have proved. But just like knowing an idea of like what you want to do around like metabolism, and then understanding, okay, this is what the professor, I don't know how you'd refer to preceptor maybe, is doing this kind of work, and like how can I gain those skills. And I would imagine the guy who was in the lab with you was a little bit annoyed the first time, but I'd imagine those experiences are things that you really learned from, and I'm guessing there was a lot more of that that came around. And I think that that's also important, being vulnerable and saying, okay, I don't know this. Can you help me? Can you show me this? And like going over and over with it. And for people who might be listening to this, I might be interested in doing like cellular biology type work in their master's or their PhD programs. What type of advice do you have for them?
Ooh, I would say honestly, in general, with a PhD or a master's or anything like that, right? I would say going to like knowing kind of what generally at least what you want to do, but also being open to like learning new things and also being in an environment in which you feel supported, either by your lab mates, especially by your advisor. I think that is like leaps and bounds. That is where you like need the most support. So getting support from like in a supportive environment, knowing generally what you want to do, and you can build skills in what you're doing along the way. So like basic science is a very broad like field, right? You could study cells, you can study mice, you can study fruit flies. Like so much that you can do. And so if you have an idea of like, hey, I want to study like this idea and let me find someone who's really supportive in helping me get to that. That's kind of how I would say like to go about that. Unless you have like a very specific path that you're like, I want to study this exact thing in this exact way, then I would say the most important pieces are knowing the general concept and knowing that you have a supportive environment.
Yeah, and I think that supportive environment is so important, and just like leaning on people that know the information and know things that we don't know, and like using them as a leverage to kind of decrease the time gap there and
Hmm.
doing things is important. And while you were in your PhD, so tell me more about the lab that you did work for, and like what was that experience like?
Yeah, so the lab that I was with studied ovarian cancer. So my advisor had developed an ovarian cancer cell line from like a mouse model. That's the main thing that we used in that lab. And so we looked at metabolism in like multiple different ways. So I studied metabolic function. So I was really looking at like how are these cells making energy? How is this changing across like if you have a very advanced cancer versus like a less aggressive cancer? How does this change as those like during the process of like how you would typically have cancer advance in ovarian cancer, how does that change metabolism also? So mine was very functional, like getting to know like what fuel sources are being used, how are they being used, and in what ways is this changing in different aspects. And then my lab mate, he was actually more of like a mitochondrial structure kind of person. So he looked more at like what do the mitochondria look like? What are the characteristics of those mitochondria? Like how do those mitochondria like come together and like pull apart and like change their shape and their function based on like again kind of the same concepts of like the aggressiveness of the type of cancer or along that like progression cycle, like how does that change? And so we very like too much like very much two sides of the same coin, and that I was looking at function and he was looking at structure. But other people in our lab had looked at like a variety of different things in regards to ovarian cancer, like fluid stress and things that were related to like how these cells survive essentially like in their environment.
And what does looking at function of cells look like? Like how what does that measurement look like for some of us that mightn't understand that?
Yeah, so I always like to describe it as essentially I watched cells breathe. So I did different assays where I was studying mitochondrial respiration. So that's essentially looking at how the electron transport chain. If any of these things are ringing a bell, you might know what I'm talking about. But essentially, I looked at how the mitochondria were functioning based on how the oxygen exchange was happening. So like I had different devices that could look at the change in oxygen when we would inhibit certain parts of the mitochondria. So like if you inhibit one of the complexes, like what happens to it? If you inhibit this one, like it was a very like systematic way of kind of blocking certain parts of the mitochondria to see how it reacted, which gave you an idea like this is how these cells respond to stress. Like this is how much energy they're making. This is how much is kind of in the background. It's not like actually from the mitochondria. And I also looked at kind of how like what fuel sources the cells are using. And so that was an assay, like the types of assays that I would do for that is like I would give them certain fuel sources, like I'd give them glucose or I'd give them like a certain fatty acid. And then I would be able to see how they're using that because of like a color change in like an assay plate. So that was essentially like as they're making energy through the mitochondria, they're taking a thing that is like a certain color and they're changing it to a different color because of like the change in oxygen usage. So it was super interesting, like way to study that, like very minute way. But I mean, it kind of relates to like how we study metabolic function in a person, like our oxygen and CO2. Like that's how we study metabolism in people. So it's just on a very very small scale.
Yeah, and that makes a lot of sense, and that is cool and awesome. And I also did some microbiology as a biology major
Oh,
in undergrad, so I have done some assays and killed many cell lines as well. So I understand how that goes.
oh yeah.
Um, okay, so while you're in your PhD program, you had like a couple different positions, and I just so we could talk more about like your Instagram and your postdoctoral stuff, I would just want to know like if any of these stand out as ones that you want to talk more about than others. So you were a dietetic intern at the Individualized Supervised Practice Program at Virginia Tech, instructor of record on health counseling at Virginia Tech, a graduate teaching assistant at Virginia Tech, and then an adjunct professor at Virginia Tech. So you can talk about all of them briefly, or like if there's any one that was like most formative, I would love to hear more about that.
Yeah, so I will skim over, and then I definitely want to talk about the dietetic portion of it. Well, I don't want to skim over the teaching portion was like a massive thing that I did in my PhD. So, my assistantship that paid for my tuition and paid me a stipend was the teaching assistantship. But there was one year that the professor for that moved on to a different position to teach like a different class, and so they were like, "Hey, do you want to teach that class?" And I was like, I would love to try it out, right? Like except it was like a massive class, like 120 students. Like I was like, I can do this. Like let's try it out. So I ended up teaching that class for like 3 years. I was actually the instructor during when the pandemic hit, so that was interesting to like facilitate a class that had been in person to change online as I was a student myself. That was a very interesting experience, and teaching online too was also like a complete change that I had to do. But I loved that experience, and like I learned a lot from that, and had like great student interactions where I was being able to interact with the students that were in that class and like teach about health counseling, which included like a whole bunch of like behavior change. And we also talked about like social determinants of health and like health literacy and like bringing in all these different areas to really understand what do we need to know about people when we're counseling them. Like we need to know a lot of things. We need to keep in mind a lot of things. And so I brought in like accessibility and like, talking about like diverse populations. And it was a really great experience to be able to teach that class. And I'm really glad that I got to do it. So that's my skim for that. It was a great experience. But the dietetic internship is actually how I ended up becoming a registered dietitian. So, like I said, in my master's, I couldn't afford the traditional internship model, and so so Virginia Tech has what's called an individualized supervised practice program. It's usually for people who have PhDs who want to become a dietitian. It is not like your typical internship, and so like very very limited in who is able to do those. But I was able to do that during my PhD. I still had to pay for it. It was very expensive, but I was like, had the privilege of taking out a loan to be able to pay for it. But it's important that I was able to do it during my PhD because I was able to get paid as an instructor to be able to like still live and be able to finish the PhD and do the dietetic internship at the same time. And so if I hadn't had that opportunity, I would not be a dietitian today. And if it hadn't worked out that way that it did, I would not have been a dietitian. Like I would have just gotten a PhD and I would not have done the internship because I couldn't afford the regular internship model. And it just so happened that I had the opportunity to do it and get paid at the same time to do like a separate job essentially. And I was able to extend it so that I could, do a PhD dietetic internship at the same time because you're working. When you do a dietetic internship, you work as a dietitian. And so like I was able to do it part time. I was able to stretch it out, and I was able to get paid to be able to live. And so like I definitely wanted to talk about that because that's not a very typical way to become a dietitian. And it's very much like the only way I was able to do it. So that's like one of the ways that, it kind of worked out that I'm now a dietitian.
Yeah, that's cool, and it's really wild that they create such a big barrier to become a dietitian. I didn't realize that, and it is very very interesting. I don't understand it, but I guess I haven't
I
really
don't
thought
either.
much about it. Yeah.
No.
And I would like to hear more about the adjustment of you being a student, teaching a class as an adjunct professor and professor, and having to switch over to virtual. What were those kind of changes look like from your perspective, and how did you cope around that?
Honestly, it was a lot of me figuring it out myself. So I had the opportunity. So I took over the class in fall of 2019. So I taught it in person for one semester. And so I had at least the, I guess, confidence to know what I was doing in terms of like, this is how the course is structured. Like, because I was doing everything for that class. Like, I was making the learning management system course. I was making the assignments, I was making the exams, I was making the lectures. Like I did it all as a student, like as just a professor would. And so when the pandemic hit, it was kind of like, figure it out, like go do it. You're the instructor. And I was kind of like, I don't know what I'm doing, but okay. And I got some support from that, but there were also a lot of times where I didn't have access to something because I wasn't faculty, because they still considered me a teaching assistant. Like I'm still a student, so they didn't give me access to like a lot of things that they gave faculty access to. And so a lot of it, especially with that class, I was just really honest with the students that were in that class this semester and be like, listen, y'all don't know what's going on and I don't know what's going on either. So like we're just gonna figure it out together and we're just gonna try it out. And like it actually worked out like really well. And the students were really understanding. And because I sure told them, I was like, I am doing this by myself. Like this is everything that you see is me. Like so it was a lot of like relying on each other and of transitioning to how do I teach online? How do I use Zoom? Like as we were all doing kind of during that time of just figuring out how to work from home. Like I was just doing that though with the course. And so it was a lot of us relying on each other for sure.
Yeah, and I think that candid honesty and openness, I think, was probably appreciated and just made everyone understand that it was some crazy times and everyone is trying to adjust and figure things out. Well, kudos for you for being able to persevere through that as well. Yeah, and just like overall on your PhD, were there any like takeaways or advice that or like things that you learned that you think would be important to share with the listeners?
Again, I feel like kind of to reiterate things I think I've already said, you can figure out what you want to do along the way. I definitely did because once I got to my PhD, I was like, okay, wow, like I love cancer research. I love cancer metabolism. Like I am so glad that I ended up here. And I would not have ended up there if I hadn't like messed around with other things and kind of like ended up there. And also like I would say go with your gut. Like if your gut's telling you that you should do something, like that's probably something you should maybe listen to and find a supportive environment. Like I am 1000% thankful that I had the advisor that I did because she was so supportive. She was so helpful. She really made my PhD experience like really worthwhile and really amazing. And I know a lot of other students that didn't have that experience. And so I would say especially anybody considering a PhD, make sure you and your advisor like are good team, are good fit. Because if you don't have that, like the research could be as interesting as you want it to be, but if you don't have a supportive environment, it's not going to be the same.
Great advice. And after your PhD, you were able to get a postdoctoral researcher or become a postdoctoral researcher at Pennington Biomedical Research Center. So firstly, what is a postdoctoral researcher and why is it something that you wanted to get?
Yeah, so a postdoc is it's essentially like extra training. So after you finish a PhD, if you want to do any kind of like research on your own, if you want to enter like a faculty position, and even like some industry positions also require a postdoc. It's essentially like an additional training layer of saying like, okay, you got the PhD. Now, like you need to learn how to like do things on your own. I describe it kind of like I give the analogy of it's kind of like a medical residency. Like by the end of like medical school, you're a doctor, but you have to have extra training to do what you need to do as an actual like practicing physician. It's the same thing, but just for PhDs. So it's a chance to get to know like how do you do research? Can you conduct research? Like can you like write papers and be involved in labs and like all of this kind of stuff? It's just extra training where you are learning to be independent essentially. And that's one of the reasons I wanted to do it. Plus, like I said, a lot of positions now that are requiring a PhD level like person are also requiring postdocs, just because it's that extra level of independence.
Okay, and that makes sense. And in this postdoc, you're doing work around cancer energetics.
Mhm.
What is this about? I'm guessing it has to do with metabolism, but tell me more.
Yeah, yeah. So I specifically saw a postdoc that would help marry all of my experiences. So, we talked about I was in community nutrition, I was in basic science, I'm a registered dietitian. Like I'm on across like this whole research spectrum, but I hadn't done clinical research yet. And I just loved the opportunity to bring to help research along the spectrum of being able to like talk to and collaborate with and bring basic science into working in people, because like working in cell lines and working in mice is one thing, but transitioning what we know about those things into free living humans is really hard. And then I also wanted to be able to bring in my dietetics and like community nutrition background into that clinical research, because I think one of the issues of us like moving research from bench to bedside and beyond is like the three arms don't talk to each other as well as they should. And so oftentimes, like, especially basic science, but sometimes research doesn't know what it's like to practice, and sometimes practice doesn't know what it's like to research. And so I was like, okay, well, I have these two things, like, I want to marry them and do more clinical research. And so the lab that I'm in now at Pennington is very much a clinical research focused lab, that's just like, clinical trials using actual people, which is really great. And it's the main focus of the cancer energetics department and of my advisor is kind of looking at lifestyle modifications. So my advisor is more of like an exercise physiologist. So he brings in the exercise background, I bring in the nutrition background, and we kind of work together to move towards that like more like lifestyle like intervention, or how those lifestyle factors can affect cancer outcomes. So that's kind of what I'm doing as a postdoc.
Okay, awesome, awesome. What was that process like for looking for a postdoc, and what advice do you give to people who finishing up their PhD and they want to have that extra level of training? Like, what are the things that they should look out for when looking for postdoc experiences?
So whenever I was trying to figure out, okay, how does one find a postdoc? Because they're kind of posted as jobs, but also not really, right? It's kind of more of like a you cold reach out to people and be like, hey, I'm interested in a postdoc position. Do you have one? Like it's very much like that kind of process rather than just like a like job search on Indeed or something like that, or like LinkedIn even. You can find some like that, but it's not usually like that. And so I just ended up I was like, okay, I know I want to study cancer and, you know, energetics and nutrition and exercise and people. And so I originally started there and I looked for papers, I looked on clinicaltrials.gov. I was just like, who studies this? Like, how can I connect with someone who studies this? And I connected with a couple of different people. I connected with some postdocs that were also studying this like general like topic. And then it was a lot of like word of mouth kind of thing. I did apply and like interviewed for a position at like the National Cancer Institute also, but I interviewed with a lot of other just like people that were at different institutions. And honestly, like again, through the whole process, I'm gonna keep reiterating this, trusting my gut was like the one thing I am so glad that I did, because I ended up in the lab that I'm in, and it's been a fantastic experience so far. Like, and I'm really glad that I took that kind of like gut feeling, but also just really took the time to get to know the people who I might be doing research with, because again, just like in your PhD, if you're not in a supportive lab environment, like that's going to make a difference. And so, like, finding people who I agreed with, like fundamentally in terms of like the research, but also like personality wise and research wise and like location wise and like being able to do the research that I wanted to do, was a huge factor in how I like ended up, deciding and like interviewing and talking to people that were in my field and who might have postdoc experience, like open, that kind of thing.
Okay, awesome, awesome, and that makes a lot of sense. Okay, and now earlier in the interview, you said that you use social media initially to do like outreach for your nutrition type work. If people listening to you, I feel like they should be following you. If they're not, at steph.compton.phd on Instagram. Be sure to follow, like, very informative content, very entertaining content, I would say, as well, which is not something you get a lot from people who I feel like are doing like heavy research type of work. So I appreciate that a lot, first of all. So when did you start this Instagram page?
Yeah, so I started my Instagram. I think it was the second year of my master's. or maybe it was the first year. It was before the pandemic. I think it was like 2018. So I started it during my PhD mainly just to like get practice with science communication because I also did a lot with science communication during my PhD, and so I just wanted like some practice with that. But I just the internet's a special place, and I just saw a lot of like nutrition misinformation. And I mentioned when I went into my master's, I wanted to know the nutrition secret, and then I learned that there wasn't one. And so it was kind of like, following that, like, kind of revelation for myself, and then seeing the nutrition misinformation that's on the internet. I was like, I want to help people like learn about actual nutrition science and like be able to ask questions and dig deeper in what they see so that they don't fall for the same things that I fell for before I knew any better, kind of thing. Or, even in some cases when, it's really hard to see through that misinformation, like it seems really legit, like how can you ask questions to dig deeper through that? That's really why I started it.
Okay, and very, very important reasons that I feel like health misinformation is one of the greatest or like
Mhm.
the greatest parts of like misinformation out there because there's just so much misinformation out there that just seems like it's okay and it works. But we appreciate you standing out there and like showing up on your social media and de debunking myths and other things that just aren't true around nutrition and dietetics and all of that good stuff. How have you used your social media platform to leverage for like academic opportunities, if at all?
Yeah, yeah. So honestly, I went for a really long time not necessarily doing a lot, like in terms of like I guess a business side of doing like outreach like this. Mainly because I was like a PhD student. I was like, I have so many things to do. I don't have time to do this, and I really just enjoyed posting on social media, and I still enjoy posting on social media. But I did eventually kind of lean into because my audience is slightly skewed more towards I have a lot of like fellow professionals that follow me. And so there was a kind of ask and a kind of like lots of questions that I would get from fellow professionals as someone who was doing research of like, okay, well, how can I do more research? Like if people are asking me these questions too, like how can I better go out and like look for this information or like communicate this information? And so I eventually then formed what's called the Nutrition Lab. So the Nutrition Lab is like kind of a learning platform, very accessible cost learning platform where professionals and I originally started it where it was like also just general nutrition content, but now I just have the Nutrition Lab Pro. And that one is mainly focused on helping nutrition, health, fitness professionals who want to learn more about finding and reading research, like research methods, like how do you go out and find information about things that people are asking you about? Because I know like not everyone has that really like in-depth experience of like again finding and reading research articles because that's not something that's taught very widely, but it is something that's really important for every level of professional. Like even if you're a nutrition coach, if you're a registered dietitian, if you are like a nutrition scientist, if you need to be able to do that kind of stuff and like be able to find answers. And so that's kind of what I eventually started to do just because I really wanted to help fellow professionals be able to do that. And then I also, this is very recently, developed a course on science communication to then help professionals who were essentially like doing that finding and reading research, how they could then communicate that. Because I got a lot of questions, again, from that Nutrition Lab Pro platform of people being like, okay, I know how to do this and I have all this knowledge in my head, but I cannot communicate it with other people. Like I don't know how to break it down. I don't know how to like make it relevant. Like how do I communicate this? And so that's kind of the lead into the forming of SciComm Essentials, which is the course that I made. And I just like launched that a couple of months ago. So that was kind of a more recent thing. But that's kind of more of the, I guess, like business side that I've leaned into of really helping connect professionals to research because I don't think that connection exists as much as it should.
Yeah, and I like that thought process, like just getting questions from professionals and saying,
Hmm.
okay, these are the things people are asking. Let me create that platform to help support them. So what were the kind of things that you thought about as you were setting up for like more of that business side of the Instagram?
Yeah, so one of the big things for me was thinking about like how can I make this in a way that would be useful and accessible and like actually be something that people utilize. And I've gone through many iterations of this. Like there's been people in the Nutrition Lab Pro like since I started it that they've seen me iterate this of like changing it and like making it better, making it more specific, like changing the things about it to make it based on what people were asking for, what people liked, or that kind of thing. And so a lot of the thought process of that was like polling my audience and asking like, what do you need? What do you want? What is a gap that's something that you want to fill? And how can I help fill that gap? And so the kind of iterations again, I wanted something that was a place where you could kind of, like, especially keeping professionals in mind, like people don't have a ton of time to sit down and like listen to like 17,000 lectures that are an hour long on one thing, but they can go into a membership platform and like read a quick article about what is a p-value or like how do you read an abstract or something like that. And so it's like that kind of platform making was what the Nutrition Lab Pro was. And then for SciComm Essentials, like I kind of got the feedback now as we're kind of like from the creation of the Nutrition Lab Pro, which is a membership platform, to now people are like, I have too many memberships. Like there's too many things that I'm doing. And so like people really wanted more of a like structured course to kind of take them through, which I felt that kind of content a little bit better too, of like this is like the process of how you can like break down a topic and communicate science so you can apply that process to other things like after you take the course. And so that I feel like really fit really well with that. And you know, I might end up changing the Nutritional Pro. Like I've been thinking about it, percolating about it too, but it's just that process of like constantly kind of reiterating and like making sure that I can make it the best that it can be.
Yeah, and I love that. I think too many people get stuck on like wanting to make it the perfect thing before putting it out
Hmm.
there. But like to your point, you started the Nutritional Lab Pro, and you said you had members from the beginning who were able to see all the iterations, all the things that changed and adjusted. And as you got like more direct and more feedback and just more understanding of what the community needs. And I think that's very similar to like what I've been doing and like just creating content and stuff that people have been asking me around and like building out different things. New things are going to be coming out soon, so keep posted for that as well. But yeah, I think it's really awesome. And so you said that you started this in your master's. You did it throughout your PhD program, which I believe is in that period of time, sometime when I followed you. How did you manage your time and posting content and working on the Nutrition Lab Pro and working on this course while doing all of that?
Yeah, so it's been a lot of like probably working a little bit more than I, I should have. But honestly, it was just something I was so passionate about that like even when in between doing things for like, what I was doing as a PhD student or like that kind of thing, it was something I still really liked to do. Like I got the satisfaction of doing something that I really enjoyed. I have always said that I feel like social media really hits on my like love of like teaching and communicating and connecting. Like I really love to have that outlet, and so it was more of an outlet for me than it was like a chore or a job. And there are times like throughout that time where I was like, I can't do this right now, like I will not, like it is a chore right now. And so like making sure that I took breaks and also like made it fun for me and fun for other people was kind of like that made it easier to be to be able to do everything, and taking breaks when I need to. Like this past like 2 weeks, I like ghosted Instagram for like 2 weeks because I was like, I need to focus on what I'm doing. So like, making sure that I do value my own time and also value like what I put out, and really only putting out like things that I'm like, okay, this is fun, this is educational, like this is what people are asking about, this is helpful content, that kind of thing, or like connecting content, makes it a little bit easier to be able to like do altogether.
Yeah. Great insights. And I think taking rest, taking breaks are very, very important
Hmm.
because rather you like take that break while you're starting to feel tired than burning out and then like having to stop for a longer period of time. Um, I wanted to ask more about like, because you're also an Instagram platform while I switched over to like more reels and
Hmm.
you make a lot of reels, you make great reels, but I'm not too sure if I can't remember if I followed you when you were making content that was not reels, but what was that switch over like for you as a content creator? Was that difficult, or how did that like change how you operated?
Yeah. So I honestly sometimes I'm like, wow, like the different eras of Instagram that I've seen has been really interesting to like see how it's changed. I definitely started out more when it was just like single pictures. Like if you scroll all the way back in my feed, it's just like single pictures. There wasn't a lot of like infographic kind of stuff. And then it more moved into more like infographic swipe posts where I was making like really dense, like this is everything you need to know about genetics and nutrition in a 10 swipe post on Instagram. Like incredibly like too much content that would not really fly now. You know what I mean?
Yeah, yeah.
Um, I think it was 2020, honestly, where Reels kind of started to pick up because that's when TikTok got really popular. So full disclosure, I had actually got onboarded onto TikTok because some talent agency somewhere had found my Instagram and they were like, "Hey, we'll pay you to make TikTok videos." And I was like, money, okay, like I'll do it. I'd love to learn how to do this. And so they offered training on like how to make TikTok style videos, which obviously then went kind of morphed into reels on Instagram. I don't do as much on TikTok now. I did, at the time because I got onboarded in that, but I didn't necessarily like the TikTok platform for what I was doing as much as I liked Instagram. And so I kind of just morphed it into mainly doing Instagram reels. But I learned a lot from that experience and like, I'm still on TikTok, I still scroll. So like I see some of the trends, I see that, and I'm like I'm always thinking of how can I make this applicable to what I typically talk about and how can I help how can I use this as leverage to connect with people? So like can I take a subject that is like way more complicated but make it more interesting by adding a certain audio to it. Like I use a ton of SpongeBob audios because like my like audience is more of like that millennial age, right? And we like grew up with SpongeBob, and so like I people connect with SpongeBob audios. They're like, wow, I love this. Or like I used one like Charlie the Unicorn. I don't know if you remember that like YouTube video. Like I used that
Yes.
one time, and people were like, oh my god, amazing. But it's that like added layer of connection point that I really enjoy about Reels because you can add like humor or you can add a reference or you can add something that people like know about and then connect it to something new and it makes it so much easier to understand. I've done some reels where I like just talk, but I think sometimes it's hard for me because I like to bring a lot of nuance to things that I struggle with fitting in like everything in like a minute and 30 seconds. But I do like using those like kind of more quick reels because I do feel like they give some connection.
Yeah, 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 absolutely. And that's awesome that you were onboarded onto the TikTok platform, and paid to do that, and also like learning how to do TikTok type videos because yeah, TikTok apparently is what Reels is like maybe like 2 months older than what TikTok is. As they say,
Yeah.
all the trends go on TikTok and then they find their way to Instagram later on. But I
Mhm.
also don't use TikTok as much as I want to. Probably will change in the near future. Do you have any like tips or lessons or advice around building out a Instagram or social media presence as a professional?
Oh, that's a great question. Honestly, I know a lot of professionals that or on Twitter. I don't know how that's going to go now with what has happening over at Twitter. But I kind of used Instagram as kind of like my version of like, let's talk about my research. Let's talk about other research that's related to this. Let's talk about like just nutrition, how you can implement it in real life, and like let's debunk some stuff. And so I really had a lot of fun with it, but I've ended up connecting with a lot of professionals. Like just 2 weeks ago, I was at a conference and met like a bunch of people that knew me from Instagram and that were like fellow professionals. They're like, "Hey, I follow your Instagram. Like, let's hang out." It was an amazing experience of that connection and that networking, and I love being able to meet like fellow professionals doing that. And I think that it's super important for professionals, I think, to do at least some level of science communication because I think it helps inform you of what's going on in the world regarding what you do, and also kind of helps humanize you, gets you back from out from behind the ivory tower, and also like again, you get to learn about what is relevant and important for people who are out living their real life. Because like they ask you questions, you get to interact with people, they get to interact with you, and it's like an amazing source of like finding out that information that you wouldn't otherwise know. And so I'm a huge proponent of professionals getting on some kind of social media platform, just because you have that opportunity and you get to practice communicating your science. Because a lot of us get like really down in our rabbit holes and we don't learn how to communicate it out, and it's a great place to practice.
Love that. Love that. Yeah, definitely think it can. help you a lot more than I think it could harm you. So there's no loss in like trying to build that social media brand. Just sharing what you're learning, showing what you're doing, what you're researching is all things that people like we don't know about, but it's interesting to a lot of people out there, and like just sharing it is important. Okay, so before I move you on to the final section of the show, I want to ask you, where would you like to see yourself in the future?
Oh, that's such a great question that I'm still trying to answer. Honestly, I have really fallen in love with research recently, and I really want to see like what I could do in the research realm. I love doing what I'm doing. I love answering the questions that I'm like trying to look into and things like that. And I love making the connection between, again, bitch to bedside to beyond in nutrition and cancer research, because that's such a needed area. So I love that. I'd love to see be doing like more of that. And I really like doing what I do on social media too. Like I want to continue to do that. I want to continue to connect and provide education. And again, like just teaching people either pros on how to find and read research, that kind of thing, or just people who are in general just want to know more about like nutrition science or cancer research or how to debunk things or like what things need to be debunked. I can see myself like continuing to do that. I'm sure social media will change drastically in the next 5 years, but I'm excited to kind of keep going with it and that kind of thing.
Absolutely, absolutely. I mean, we look forward to seeing how that all unfolds. And be sure to follow Stephanie on Instagram and TikTok if you have not as yet. All her handles will be in the description as well, so check that out. So moving on to the Furious Five, the 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
I would say shadow as much as you can. Get to know all of the possible positions that you may be interested in and all of the different ways that you can make things work. I think one thing that we often forget is we think we have to be very like straight and narrow, like this is the way to become this job, when in actuality there are many different applications of the same thing. And especially in public health, like there's such a like gold mine of different things and different ways that you can apply like the same kind of concept. And so I think just like shadowing and really being innovative in how you want to apply it and what's relevant to you.
Absolutely. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Again, shadow. I would also say with so at least a postdoctoral fellowship, I would say reach out to people that you know, network with people that your advisor or like people that you know in research, like network with them. Honestly, word of mouth is huge for getting a postdoctoral research fellowship, and really like delving into what you want to do. Like go read papers, go reach out to people, like literally just cold email people. That's a fantastic way to connect. Don't be afraid to do that.
Great, great advice. And number three, what's something you're working on improving in your life right now?
Definitely my grant writing skills. Just submitted my first grant. So I've never done like that big of a grant before. And so I definitely am trying to improve that. I'm also trying to improve. I recently ran a half marathon. And so like I'm still trying to improve my like running because I didn't run for like a decade or something like that. And so like just in my personal life, I'm like, I want to get back into running again. And so that's kind of what I've been doing this past year. But yeah, that's some of the things I've been working on.
Awesome. Well, congrats on completing that half marathon. That's awesome. Number four, professionally, do you recommend anything?
Um, I saw this question and I was like, I am the worst. And actually like reading and listening to things, and connecting. I mean, obviously would recommend your podcast. I would recommend also just connecting with people on social media. I think that's a massive area. And I think there's so many cool like recommendations I could make just from social media, like what other people are doing, like other professionals are doing, and like what they created. Podcasts are a fantastic way to get to know things. So it's just like this one, like you get to know so much about different career paths just through something like this. I would definitely say like that kind of avenue. It's kind of more unconventional, but you would think in like a professional whatever like recommendation. But honestly, like connecting with people on social media and like finding those avenues like podcasts and things like that is really cool area.
Yeah, could not agree more. And number five, last but not least, where can people connect with you?
I'm definitely on Instagram the most, so at steph.compton.phd. I am kind of on TikTok, but not as much on TikTok. And then, yeah, I would just say mainly with Instagram. You can, DM me there or say hello. I'd love to hear if you listen to this episode. Just come say hi, that kind of thing.
Yeah, absolutely do that, and we'll be sure to leave all those links in the show notes and the description so you can check that out. Thank you so much, Stephanie, for coming on and sharing your story. Definitely very inspiring, especially on the social media side from my perspective, the work that you do, and just keep it up. Love to see it, and I'm glad that we can have you on today and share your story.
Thanks for having me. I just had a great time.
Awesome. Housekeeping items, everyone. Thank you so much for watching this. If you are watching this on YouTube, be sure to subscribe, hit that like button, leave a 5-star review if you're watching it on listening to it on a pod with a friend. See you all next week. Peace.